My name is Erin Colburn. I'm the Pre-Health Advising Coordinator for the College of Health Science at Boise State University. It's with great excitement that we get to share a little bit of information about a unique field that maybe is kind of one of the unsung heroes, I think, or folks that maybe you don't realize that they're back there working and doing what they do. I have Kirk Bingham from the University of Utah Perfusion Program to share a little bit about perfusion, their program, what makes it special, and so go ahead and take it away when you're ready.
All right, thank you, Erin. I appreciate that. Like I said, I'm a little biased when it comes to perfusion because it's what I do and it's what I love to do. And so I try to talk everybody into going into it, but it is definitely not a profession for everyone. It is a specialty of medicine that you really have to love to want to do it for your career. And so that's kind of why I'm here, is to answer your questions, talk a little bit about our program, why the University of Utah, because there currently are 17 perfusion programs in the country. And so there's not a lot of them. The biggest program is Midwestern down in Arizona, and they take about 40 students per year. Right now, we're taking about 5 students per year. So we're significantly smaller than the largest program. And that is definitely by design. And we'll kind of talk about that as we move forward. But I'll tell you a little bit about myself. I'll kind of jump into my PowerPoint. Is it okay if I share this PowerPoint with you? All right. All right, everybody see that okay? Let's see. Pull up. So our program is a master's degree. Now in perfusion, there are 3 different types of degrees that you can get. There's the certificate route, there's the bachelor's route, and there's the master's route. Now, many of the programs that are in the certificate side or in the bachelor's side are actually moving to the master's program. And so we decided when we started the program a couple of years ago that we were just going to go straight to master's to make sure that we were staying up with the current trend. So our program is a Master of Science in Cardiovascular Perfusion. Like Erin had said, my name's Kirk Bingham. Just to give you a little bit about myself, I'm originally from Utah. I did my undergrad at Utah State University. I know that that's kind of a rivalry of Boise State, and so don't take anything outside of just the fact that I went there for school. I did my training in exercise science. I went to Midwestern University and got a master's in cardiovascular perfusion back in 2014 to 2016. When I did my first rotation there, I actually got interested from the perfusionists that were at Mayo Clinic and decided to apply for a job there. And I worked there for a couple of years as a pediatric and adult perfusionist. So I could be doing a pediatric patient that was 5 kilos in the morning and be working on a 80-year-old 90-kilo adult by that afternoon. So it made it for an interesting work experience, but I loved working there. But I actually heard about the job opening here at the University of Utah and how they were going to be starting a school. And so I'd spoken with them and they had recruited me to come here and to start the perfusion school. And I've been here ever since. So I'm super excited to be talking with you because I love perfusion. I love talking about it. And I love trying to find individuals who are passionate about medicine and potentially about perfusion. And so I'm one of those individuals that I will answer any questions that you have, even if it's not about perfusion, even if you want to know something about the anesthesia side or the surgical side or the PA side. I am more than happy to talk with you about any of them because I talk with those individuals every single day. So I know a little bit about what their jobs are like, and could even put you in contact with someone if you wanted. So I love perfusion, and I will definitely try to talk you into perfusion. But at the same time, it's not for everybody, and I'm happy to work with you, as I'm sure each one of your counselors have been doing too, in trying to find the right path for you, because we want to find individuals who are passionate about perfusion, as it's not a very well-known profession here in the United States. We're pretty small. There's only 4,200 perfusionists in the country. And so our community is very small, but we're one of those individuals that I kind of compare us to Spider-Man a little bit. I know that's kind of my nerdy side, is that nobody really knows who we are, but we do pretty cool things every day. You know, we're kind of behind the scenes, and the families don't know who we are. And most of the time, the patient, the families don't even know who we are until they see cardiovascular perfusionists and how much it costs them in order to have us be there. And so that's just who we are behind the scenes. But so what is a perfusionist? Now, we're vital members of the cardiovascular surgical team. We primarily are responsible for running the heart-lung machine. I'll show you a picture of that heart-lung machine here in just a moment. Another name for that is cardiopulmonary bypass. And just as it sounds, we literally bypass the heart and the lungs in order for the surgeon to be able to work on the heart or on the lungs to either transplant them or to repair them. We do other jobs that are in conjunction with running bypass. We do cell salvage, we do anticoagulation strategies, ECMO and ECLIS. I'll talk about all these just a little bit as we move along. Now, I feel free, if you have a question, just interrupt me. I have no problem with answering questions as we go, because I tend to talk fast at times. And so, but anyway, so we also do HIPEC, which is a type of chemotherapy treatment. We primarily work over at Huntsman Cancer Institute here in Salt Lake City. And then angiovac procedures. And kind of a fun note about this is, before I even knew the angiovac existed, my mother actually was one of the first experimental patients that the angiovac was used on, and it's actually a clot removal device. And so I'm very appreciative of this procedure being invented, because it saved my mother's life. But unbeknownst to me later on, that I'd be running this very equipment. So here, just a quick shot of what a bypass circuit looks like. You can see here on the left all the equipment that we run. Right here, kind of out of the shot, is this equipment that you can see here on the right. You can see the blood running through each one of the tubes down into the reservoir. And our whole job is to make sure that the patient is able to stay alive while their heart and lungs are not being used. They're being bypassed during the case. And so there are a lot of things that go into it, a lot of the training that goes into this. And so we aren't just going to train you here at our program about this circuit. We're going to be teaching you how to do surgery, as that, you won't be doing surgery, but you also will need to know how they're able to do each one of the surgeries, so that you can help the surgeon and those assisting at the field. And so this is a lot of the equipment that we run. Now, kind of a fun fact, a lot of the past perfusionists that were trained actually were trained on the job. Most of the individuals were engineers and individuals like respiratory therapists that were just doing their job day to day. And the surgeon walked into them and said, "Hey, you know how you're kind of mechanically minded and medically minded? Do you want to come run this equipment?" And that's how perfusion kind of started. And then they started doing specific trainings, and that's where our program has come. So this is just a little schematic of what we have to run. I won't go through all the little steps of this, but we have to create these schematics every time we want to create a new circuit for our particular hospital, so that we know exactly how everything's going to run and how it's going to work. You can see the blood coming out the right side of the heart, down into the reservoir, it's oxygenated, it's split off, goes through a bubble trap because bubbles are not our friend, especially when if we do not want them to go into the patient. It's then perfused into the aorta and then into the rest of the body. Another thing that we do during these procedures is that the surgeons need to be able to work on a heart that is not beating, because if the heart's beating, it makes it very difficult to see what you're doing, because you can imagine trying to make these fine sutures in the heart. And if the heart's beating very hard, it would be very difficult to do so. So we actually will put the heart to sleep, and using a cardioplegia solution of mainly potassium. And it's kind of fun during the Valentine's season. I can say that I'm a heart stopper, and I literally stop hearts for a living in order for those to be worked on. So it's just kind of fun and cheesy, but there you go. We do cell salvage. We run machinery that actually can be used to suck blood from the chest cavity. We can preserve the blood, we can wash it, and then give it back to the patient so that the patient doesn't have to get blood from a donor in order for it to be given to them to get the hematocrit that they need in order to survive. So that's just one of the things we do. This is one of the things that you've probably heard of, especially with COVID, is that ECMO has become very popular in the COVID world. And ECMO is extracorporeal membrane oxygenation. It's basically a circuit that helps produce oxygen when your lungs can no longer function. And so we work by running these ECMO circuits, and it's kind of fun, and it's tough too, because at the same time, when you're going into an ICU and having to gear up and protect yourself from COVID itself so that you're not getting sick and passing it along to someone else, you have to go in and help them get on this equipment and then be able to maintain it while they're on it. And some of these patients will be on it for weeks. We had individuals, and still have individuals, that have been on for 300 plus days. And I'll show you a little bit about what this equipment looks like. So you can see with ECMO and ACLIS, we can different approaches. You can see the different lines running from the heart, from the femoral artery and vein, from the internal jugular vein and the axillary artery. These are just different ways that we can cannulate to help support their lungs. And as you can see, we can ambulate. We can take these patients on walks so that they're able to keep their muscle mass up while they're on ECMO. Any questions so far? Kind of crazy stuff. I know I'm going through it quick. Our job in our program is to train you to all of this. But as you can see how complicated this can be. You can see all the IVs that are running. You can see the ECMO circuit. This is actually a pediatric circuit. You can see the little kiddo that's laying up on the table that's helping support this little kiddo's heart until it recovers. This is what the cardio help system. There's lots of different equipment that we use in order to do it. But this is the oxygenator that we use to oxygenate the blood, which acts just like your lungs, but is a lot smaller. We also do VADs, which are ventricular assist devices. This one down here in a kiddo is called the Berlin heart. We can help with running this equipment, sometimes with setting up the equipment and even helping with insertion, depending on the hospital you work at. But this is for patients who have left ventricular failure that need support until they can get a transplant. Yes, Olga. Let's see, I got a raised hand. Go ahead.
Yeah, this looks, I mean, fascinating, but it also looks incredibly complex. So in the life of a perfusionist, you're working on somebody, are you alone on this team? I mean, are you the team, or do you have a team?
So we've got a team. That's a great question, because there'll be a surgeon, an anesthesiologist, a PA. Sometimes there will be a surgical assistant. Sometimes there will be other fellows or residents. They're working, going through medical school that will be helping. And then we're on the side running the equipment. So, and then there'll be nurses in the room as well. So it's a rather large team that is going to be working on this to get this up and running.
Thank you.
No problem.
It looks like a lot. Yeah.
Yeah. And it can be intense at times, but as you do it more and more often, the muscle memory is there. But we prepare you here at our program to get ready for all of these different things that you're going to be working with, and also put you through a little bit of disaster management too, just to make sure that if something goes poorly, we know how to fix it, or you'll know how to fix it.
So we have 2 questions in the chat room. One is, what is the survival rate of patients on ECMO, COVID, or otherwise?
That's a great question. So it depends on the patient, and you're going to hear that a lot in perfusion, is depends, because it depends on, one, their comorbidities. So what is their other disease state? So if you have a patient who has diabetes, who has prior surgeries that were done that make this a redo procedure, do they have other sicknesses that you have to be concerned with? Do they have some bloodborne pathogen that they have to be fighting at the same time? And so with COVID, what we found is that it is kind of a 50-50 shot. And you just never know which way that patient's going to go. And so we do everything that we can on the COVID side to give them the oxygenation and the support that they need and try to fight off, because COVID constantly wants to fight the circuit that we are trying to save them with. And so the body clots, the body has issues that we try to protect the patient from in order to prevent them from having any adverse effects from it. And so with COVID, it's about 50-50, and sometimes it's even 30-70. It'll get down as 30% survival compared to 70% death rate on ECMO. ECMO in general without COVID it depends on what they're put on for. Individuals that are put on for respiratory distress, you're looking at about a 70% survival. But those who are put on for cardiac distress, it could be totally opposite, be 30% survival. And so it kind of depends on the patient that you're putting them on for, and the age of the patient, the comorbidities of that patient. And so there's a lot of factors that play into it, but it kind of varies. But in most cases, it's kind of a 50-50 shot as to whether it's going to work or not.
And then the other question we had was, how much does some of this equipment cost?
That's a great question, because I'm always thinking about cost when it comes to, especially for our program, trying to cut back cost on tuition. And so I'm just going to take you back. So this pump right here on the left, that pump in particular is a $300,000 pump. And typically you have between 5 and 15 of those per hospital. And so you think at 300,000, you're looking at 1.5 million on the low end just for this pump. This ECMO circuit, you're looking at these cell salvage circuits are about 40,000 a piece. And then these ECMO circuits, you're looking at about 60,000 a piece. So very expensive equipment, but you need it to make sure that it lasts. That bypass circuit, I could have that thing run without turning it off for months and it wouldn't break down. And that's kind of what we're hoping for out of that equipment, because the last thing you want is to be supporting someone and have the equipment break and have to try and fix it and have to do it within 1 or 2 minutes, because you think, how long can you hold your breath? I can't hold my breath very long, maybe 20 seconds if I'm lucky, 30 seconds. And so if it takes me 30 seconds to change out that circuit to get them back on, they're going to start to become ischemic. So good question.
All right.
Any other questions?
Not in the chat.
Okay, I like questions, so hit me up as we go, no problem. We also do HIPEC, which is chemo therapy. It's a heated chemo that we use for different types of cancers that are actually in the abdomen. And so we actually push hot chemo into the stomach, we flush it around, and we kill the chemo that way. All right, so University of Utah, I had to brag a little bit about it. I think the last time I did this too, and this is nothing against Boise or anything. I have to talk about the University of Utah School of Medicine too, and brag about them a little bit because I enjoy being here. But we combine excellence in teaching, research, and clinical expertise to train tomorrow's healthcare professionals. We are ranked top 15 for graduate programs and physician training programs. And you also have a couple of classes through the PA program, which is ranked number 2 in the country by US News, which is pretty great. You have a couple of classes. So even though you're coming into a program that is relatively young, we've taken the proper steps to make sure that you are given the education that you need to be the best perfusionist going out. So why choose us? We are the only academic medical center in the Mountain West region. You will have access to our state-of-the-art campus, Spencer's Eccles Health Sciences Library. You'll have the Writing Center, help, e-tutoring, online writing lab, and University Counseling Center. One of the cool things about the Eccles Library is that they have 3D printing that you can go in and do. So if you wanted to learn a little bit more about the heart and all the different structures in the heart, you could go in and actually 3D print a heart that would actually separate. You could use it as your own model to be able to take home and use at home. And so it's kind of a fun side piece for that library there. So our mission is to develop highly trained professional perfusionists to be successful, competent, and compassionate members of the cardiac surgery team. Our goal and vision is to be leaders in perfusion education, build upon our goals and our mission always, and to be prepare you to be lifelong learners, educators, researchers, and leaders in the perfusion profession. So our program, so a lot of these next slides are information that I like to cover just to make sure that any of the questions that you have may be answered in these slides. And so we are a post-bachelorette program. We're 24 months long. You have 3 semesters of didactic learning and then 3 semesters of clinical rotations. It's a multi-professional teaching experience. And so you're not just taught by perfusionists, you're taught by physicians, physician assistants, all kinds of different surgeons and doctors and nurses in the field to make sure that you are getting a well-rounded experience while you're here. What I found with my experience was that my training was all by perfusionists, which was great. And we had individuals that came in and helped us and spoke with us. But what I wanted to change when we created the program was that you were going to be taught by all kinds of different individuals. And so you actually will have classes by the ECMO specialist down in the ICU. So you'll spend time down in the ICU learning about ECMO. You'll be able to have surgeons come in and teach you about transplantations. You're going to be able to learn from doctors about research. We have Dr. Stoddard, who's going to teach you about how to do biostatistics so that you can produce a publishable paper by the time that you graduate. So it's a pretty great experience that you're going to be learning from a whole slew of medical professionals. Our first semester for didactic learning is in anatomy and physiology through the PA program. You're going to do lab simulations through Califia, which allows you to actually learn bypass before you go into the operating room. You're going to learn all about the equipment. You're going to do a lot of mathematics and physics. This is why we require certain classes that we do so that when you come into the program, you have a base knowledge of what you're going to be learning while you're here. And what we understand too is that a lot of you may not have a lot of experience in the hospital either. And so our hope is to give you a hospital environments class in order to teach you what you're going to be getting into, so that there's no surprises when you first start in your rotations. Your second semester, we do interdisciplinary healthcare, which is taught by different professionals in the country. You start your master's project. We go through perfusion sciences, mechanical circulatory support like ECMO and VADS. And then that's when you start your observations, when you start actually sitting in the hospital and observing cases during your second semester. Any questions? Am I talking too fast?
Program, what has the placement rate been? So have we graduated a class yet?
Not yet. That's a great question. So as of right now, we have our first year in rotations, and they actually are going to be graduating in May. And so far, they're going to be at about 100% graduation rate. So we don't have any individuals that are failing or having issues. They're doing really good. All 4 of those first students already have jobs in perfusion, and they're still about 6 months out from graduating. So they're in a pretty good place. Good question. All right, so third semester, you'll do your master's project, you'll do pediatric perfusion with myself, you'll do standards and liability, how we keep you safe, and out of any kind of a legal issue that might occur while you're a perfusionist, and then lab simulations. Your second year is going to be all rotations. Most of our rotations are here in Utah. We are working on rotations outside of the state of Utah, but that will be something that we work on over the next little while. And they're going to be at big centers like New York Pres and UMass, Baylor, and Kaiser over in California to give you a better experience in your rotations. Admissions required is a bachelor's degree. We do not care what your undergraduate is in, as long as you do the prerequisites and meet the prerequisites that are required of our program. And one of the things that we do require is that you have a 3.0 as a minimum GPA and a prerequisite GPA. And we have discussed in detail the GRE exam and decided that the GRE exam will not be required for our program. And we just feel that it's not a good indicator for our program to show your abilities to do well in school. And so we decided not to accept it. You can send it in, but it won't help or hurt your application if you choose to submit it. These are the prerequisites. You can find these on our website. I won't go over each one of them. Pretty basic to most pre-medical programs, but we do require that you have a C grade or higher in all of those classes in order for it to suffice. Any questions or anything? This is usually one of the ones I get questions about the most, about especially biochem, in that we don't require organic chemistry, but we require biochem. And so a lot of programs, you have to take OChem to get to biochem. But if you're at the University of Utah, there's actually a non-pre-med biochem course that you can take, and a lot of medical programs have it. And so as long as it's a 3-credit college class, it will suffice for that prerequisite. Even if it's online, we will accept it. Now, that doesn't necessarily help all the other schools that are like, oh, we want you to take OChem, we want you to take the series. And for our particular program, because we are an allied health program, we don't require OChem, but we require biochem, and that's because we do have the ability to give a 3-credit biochem course. And there are ones that you can find out there that you can take. But any questions on that one? Because that's probably one of the bigger ones. Physics just one class of physics, and then the rest are pretty straightforward.
Lorelei, the answer to your question is that yes, general chemistry would be our Chem 111 and 112 here at Boise State. The anatomy and physiology would be our bio 227 and 228, but I'm sure that the perfusion program would accept a vertebrae anatomy and human phys in the upper division for bio. Biochemistry, we have a fundamentals of biochemistry, which does require organic chemistry at least one semester of. And then the general biology, probably bio 191 and 192 would be proficient. And then physics, my guess is physics 111. We do have a pre-calculus based physics that fits that block. So
You wouldn't need the 211, the 111 you would.
it would be the 111. The minimum would be the 111. I'm sure you would, Kirk, you'd probably accept the calculus based physics if they took it.
Yep.
Okay.
Yeah, we just want a base knowledge in physics. You don't need to know in our program everything there is to know about physics, but there are a few things like fluid running through tubes and how those different velocities can change the laminar flows of that tubing and that blood running through the tubing. And so we want you to have a base knowledge. We're not too concerned with you going through the upper levels for our particular program. Good question.
Thank you.
And yeah, no problem. And Aaron, you're just spewing out those numbers. I'm impressed. I get through some of those questions. I'm like, I got to look up the number for that particular class. So
well, and what we could do too is we could look at, creating a sheet with your team. Like I could help you figure out which ones meet your needs for those topics, but that's my guess. And I'm a pretty good guesser. So Antonio is asking a question. If you did the biochemistry that Kirk mentioned from University of Utah online, no, you wouldn't need organic chemistry. But for our biochemistry course, yes, you would need organic chemistry to be able to take fundamentals of biochem.
yeah, so it kind of puts some universities in kind of this limbo, this kind of snafu, if you will, as to the way to go with that. And so we decided that we would accept any biochemistry class that's 3 credits or more. So if you are already going through that level of getting a chemistry doing a chemistry as your major, biochem is just along that path. But if you are doing exercise science or some kind of a business degree, then it may not work to take an extra 4 or 5 classes to get into biochem. And so that's why we give that option to be able to take that online course or even take one through another university if needed. So we don't have any expiration dates on any of our prerequisites, but we do require or recommend that you take anatomy and physiology within 7 years of coming into our program. We grill you pretty hard on anatomy and physiology. As much fun as that can be, because I know you've all had a pretty tough anatomy and physiology course or courses. We also do the same here. And it's because you need to be able to identify what is happening at the field, even if you're not there, so that at any moment, you know where they're working, the timing of they're working on the heart, where they're doing an anastomosis, so that you can, as a perfusionist, be able to time where the next step is going to be for what you need to be able to do. And so we go over in the PA program, and then in the perfusion part of the program, we do another anatomy, physiology, and surgical repair class just to make sure that it's solidified so that you're ready to go out. So we won't reject, that being said, I won't reject any application if it's outside of 7 years, but that will be taken into consideration as to whether or not we feel that you would be ready to take on the course load that we require. Our program is really intense. It's kind of like drinking through a fire hose of information. You just do your very best to take in and everything that you can, because there's a lot that we have to teach you in a short period of time. So we require 3 letters of recommendation. It can be from anybody that can attest to you as an applicant. We've had people from leaders in their church to leaders that came in other ways. If you're volunteering at the food bank, we've had individuals like that. We've had doctors and surgeons and PAs. We've had business professors, you name it. We are not worried about where they come from. We just want to see if they can attest to you as a person and how you might do while you're in our program. We do recommend shadowing. We may even start requiring it to apply, but that isn't going to happen yet because we're so young. We're still trying to work out those steps. But it's recommended you get 1 to 3 shadowing experiences, because in your interview day, you're going to be asked questions about those shadowing experiences and why would you want to go into perfusion. So that being said, I would love, and at the end you'll get my email. I would love for you guys, I know you're up in Boise, it's a long ways away, but we are always good to have individuals come down and shadow us anytime. We have people in all the time. We're a teaching facility, and so we probably have 2 shadowers per week. And so we would love to have you down if you want to drive. I think it's 6 hours. But at the same time, we had an individual actually drive from Oregon to come down and shadow us. And they didn't get into our program. They got into another program, but it looked really good. And I'm not saying that you have to drive 6 hours to come shadow us to do well in your application. That's not what I'm trying to get at. But it looks really good when you're working really hard to try to get a shadowing experience, depending on where you're at, because some hospitals right now with COVID, it's just not happening. But we're taking those steps that as long as you get your immunizations done, we are happy to have you come down and shadow us. Come down for a couple of days and we'll have you for 2 days straight and get you into as many cases as we can. Tuition and fees. Now, I did put the link here and I'll share the PowerPoint with you later. Our tuition and fees, I won't go into it, but we are competitive with other master's programs. Some are really expensive. Midwestern is probably one of the more expensive perfusion programs in the country, but it's a great program. I have nothing bad to say about Midwestern. But they are a little bit more expensive because they're a private medical institution. Because we are a state-run institution, our tuition and fees are a bit lower. And so you have to look into that. That's always going to be something you're going to be looking at, because to be 100% honest with you, when I got out of school, I was about $140,000 in my graduate schooling in tuition and fees. So that's what I get to pay back over the next however many years I've got set up. But with our particular program, you'll leave with about 80,000. 90,000, which seems like a lot, but the starting pay right now for perfusionists is about 125,000, with some centers starting new students at about 150 to 180,000 a year. So pretty good. Any questions there? I'll ask. You can ask me anything. I'll talk about how much I'm paying per month for my tuition, because I want you to know what you're getting into, and want to make sure that you are fully prepared. Now, I'm glad that I took on those loans, because I'm better off as a person personally having taken on those loans, but to someone else, they may not want to do that. And I'm okay to say, this is how much I pay per month, but I can pay that because this is how much I make. But maybe I won't talk about how much I make, but how much you could possibly make to be able to pay those back. So any questions there? All right. So we accepted 4 our first year and 5 students our second year. We received 44 applications our first year and 66 applications our second year. So far, our application cycle is open right now. And so far we have 70 applications and we still have a few weeks to go. I'm suspecting we'll probably have about 80 applications this year for about 5 or 6 spots in our program. We grant 16 interviews out of those applications. So it's a pretty competitive program. It's about between a 6 and 8, 9% acceptance rate from those application years. So it can be pretty competitive, but we are very serious in how we look through our applications. We had a student this last year that applied that had a 3.0 GPA, and we had a student who had a 4.0 GPA, and they both got into our program for different reasons. So we are not just looking at the student who has the 4.0. We took the student who had a 3.0, but worked really hard in other areas to better themselves and prepare themselves for school. So we don't require healthcare experience, but you have it. It will help you be a more competitive applicant. Research is not required, but recommended. You're going to do a lot of research when you're here at our program. And so it's only going to help you when you get here. So yes, it'll make you more competitive, but at the same time, you will still be able to get into our program if you don't have prior research experience. Am I moving too quick? You guys doing all right? All right. So we will, like I said, accept any undergraduate degree as long as you fulfill all the prerequisites for our program.
So we did have a quick question. If there's a situation where a GPA is a lower GPA, like a 3.0, what do you recommend to help them be more competitive?
We want to see well-rounded individuals. And you're going to hear that a lot. No matter what you are applying for in medicine, well-rounded is everything. Did you spend all of your time studying and none of your time bettering yourself as a person or learning how to juggle multiple areas of your life? And so yes, 3.0 it might seem like a lower GPA, but if you're volunteering, if you're doing research, if you're a leader in a program at the school, or a leader in your church, or you're a congregation somewhere, or helping a mother who is sick or terminally ill, or you name it, anything that can help you show that you are a well-rounded individual, we are going to look at your application seriously. We're not going to say, oh, well, we have to keep our GPA, our average GPA above a 3.5. I will never do that. And as director of this program, that will never happen. And I will never allow anyone to pressurize me. And I'm going on the record here because I know I'm being recorded, but I won't let anybody pressurize me into thinking that we can't accept someone that has a 3.0 because they're below average GPA. That is not who we're looking for. We're looking for people who are well-rounded and are passionate about perfusion, because I can train you to be the best. We can train you to be the best, regardless of what your undergraduate GPA is, or regardless of you getting a C in anatomy. I'm okay with that. As long as you can show me that you're stronger in other areas, we can work on the anatomy side. We just want to find individuals who are passionate and want to be in the perfusion profession. Does that help answer that question? I get pretty intense in those moments because I've had those conversations, and I want you to be reassured that we will look at you as long as you've got all the prerequisites done, and you will be considered as a competitive applicant as long as you've done our prerequisites. Okay. All right, so our applications opened on the 4th of October. So if you're looking to apply, we close on January 3rd. Is there anyone on here that's looking to apply this year that hasn't? Okay, I just want to make sure, because I can help you get through that process if you are. I know it's a short time, but interviews are granted in January or February and March, and then accepted applicants start in May. And there you go. We'd love to have you come shadow. My email's at the end. You can email me or you can email Shonda. She's our administrator, and she can help get you into shadow. So if you want to write down that that email, you can contact her at any time, and we'll get you in. I know it's a long ways away for you guys, but I'm being serious in that we would love to have you. And if you don't, I'm not going to hold against you either. It's like, oh yeah, you know, I'm not going to hold any of that. I understand it's a long ways, but we're always happy to have you. And there's our website. There's my email. If you want my cell phone number, I will take text messages. I'll take phone calls, you name it. I just want to make sure you're ready. I just want to make sure that you guys want to do perfusion. So email me, I'll give you my phone number. We can chat by phone. You can text me. Just don't text me, you know, at 2 a.m. because that may not make me too happy to wake up in the middle of the night. But I will still answer your questions because I want to be a program that is open and helpful and do whatever it takes to make your life better. That's what I'm here for. And for reals, if it's not perfusion and it's PA, I can help too. You name it. So I'm happy to help in whatever way I can. And if it's perfusion, then I'm super excited for you. And I'll do whatever I can to get you to that goal, even if it may not be in our program. If it's in another program, no problem. I know a lot of the directors, a lot of the professors at other programs, and would be happy to put you in contact.
I have a question, Kirk.
Yeah.
What is the best part of being a perfusionist? And what is the worst part about being a
Ooh, that's a great question. I love the work-life balance in perfusion. And in the opposite of that, I hate the call. And whoever you talk to, doesn't matter if you're perfusion, PA, surgeon, doesn't matter. Call days are the worst. When you have to stay up from 7 a.m. until 7 p.m. the next day doing cases, it's just not fun. And that's something you have to prepare for. And anything medicine related, you're going to get stuck on call. And that's a big part of, I think, for anybody you talk to is going to be the worst part. But I love the work-life balance of being a perfusionist. I work about 2 to 3 days a week. I put in maybe on average 20 to 25 hours a week if you don't take into account the school that we're running. But in the OR, about 20 to 25 hours a week. Now, that's not every center, but that's a pretty good average that you can be looking to as far as the number of hours you'll work. If you're at a private center, you might work 1 day a week. You'll go in for a case on a Tuesday and not go in for another case till the following Wednesday. But then you might work at Mayo Clinic and work Monday through Friday, 40-hour weeks, and call on weekends. So, but you do have control of where you work, and you can decide, do I want to work at that center that does 40 hours a week with call on the weekends? Maybe, you get paid a little bit more to do that. But at the same time, do you want to have a family? Do you want to be home for your family? Do you want to be home for your significant other, your pets, you name it? Go on vacation? You can choose that job too. And those options are all out there. So that's a great question, but definitely call's not fun. I never enjoy it. I've been on call the last 3 nights and luckily haven't had to go in, but the nights that you go in, usually they're pretty intense. You got to get used to those dissections.
Do any of the students or the staff have any questions?
I love this stuff. So if you don't have a question now, just shoot me an email. I try to get back to you within a day of getting it, unless I'm gone. But for reals, I I'm as open as you get. And if you want to get personal and ask questions about loan payments and all that, no problem. I'm happy to answer those questions, because you got to know what you're getting into. And when I was going into perfusion, I couldn't find anybody that would help me. I couldn't find, it was so hard to get a hold of a perfusionist to ask these questions. And so I want that to not happen to anyone else. So for reals, you just contact me.
Cool. All right, I'm gonna go ahead and stop the recording.